Very commonly, I see patients in my clinic, and when I want to discuss her health problems with her, she says, "Doctor, I do not know where the uterus is, where are the ovaries, where are the fallopian tubes, and various other things. You know the best, you tell me." But the problem is, even if I know, and I happen to know, of course, even if I tell her what to do and what not to do, and tell her and explain her where her problem actually stems from, she will not understand. You will not understand if you are sitting in your chair there in my clinic, that where is the uterus. You need to have a little bit of overview, just the headlines, to understand the health problem, so that our advice and the treatment becomes more meaningful to you. Actually, to understand which organ is where, it is known as anatomy. But you do not need to learn anatomy standing in the smell of formalin that we doctors do in our first and second years of medical college. You can learn anatomy with coffee. I have got a cup of coffee. Do you? Let's start.
Let's go to school and learn about female anatomy in the most helpful manner. Female gynecological organs stay in the lower part of your abdomen. The name of the lower abdomen is pelvis. Because gynecological organs give rise to new lives, evolution has protected it within the safety of a bony structure. We know this bony structure as pelvic girdle. The anatomy of the pelvis is very fascinating, and you have to spend years in case you want to learn the pelvic anatomy properly. But today, we are going to give you a made easy version for that. In the lower part of your body, around the uterus, there are various neighboring organs too, but we will discuss those in a later video. Let's start with a very interesting part of female anatomy, which almost looks like a blooming sunflower. The petals of sunflower are like tiny fingers. These pick up eggs from the ovary and transmit through its tube. This tube connects the ovary and the uterus. The tube has a long, complex name known as Fallopian Tube, named after anatomist known as Gabriel Falloppio, who first described these tubes. Below the uterus, there is another tube-like structure. This is much broader, though. We know this is as a vagina. Most of the traditional magazines and newspapers finishes anatomy here. They won't talk about a particular area of female anatomy, which we'll learn in few seconds. Let's go inside the lower abdomen again. Two almond-shaped organs are there. These are ovaries. Uterus. Uterus is like a hotel room for a baby. The room that has a door facing down. Inside the uterus, the baby stays for 10 months before it is born. And they gather their nutrition via a rope-like structure from the wall of the uterus, which is known as umbilical cord. Cervix. During pregnancy, the uterus becomes bigger by about 400 times. A tight band around the neck of the uterus remains closed, just so that the baby doesn't slide out prematurely by the forces of gravity. Fascinating, isn't it? This band is known as cervix. It bridges uterus to the vagina. Ovary. Inside the lower part of the female abdomen, we have got ovaries, as we can see in this video. From the ovary, egg comes out, one in each month. One from the left ovary, next month from the right ovary. The yellow circular structure inside the ovary is the egg. Once the egg comes out from the ovary, the petals of the sunflower, that means the parts of the fallopian tube, moves like a finger and rescues the egg inside the fallopian tube. Women have got two ovaries, one on each side of the body. The primary purpose of the ovary is to produce female hormones, estrogen and progesterone. Ovary also produces one egg every month. Around 49-50 years of age, the ovaries fall asleep. We call this a menopause. Women stop menstruating. Fallopian tube. We have already learnt about fallopian tube, where the egg and sperm meet. We will hear the story of meeting the egg and sperm some other day. Vagina. Let's now go down below the uterus. Beyond the cervix, there is a broad tube-like structure. It's known as a vagina. A vagina is quite elastic organ, and it accommodates the baby when the baby is born naturally via vaginal route. Vulva. Below the vagina, in between two legs, there is a special area which is covered in skin known as vulva. Many social books, magazines and newspapers will not talk about vulva for unknown reasons. Women sometimes mistakenly call this area as vagina or simply down below. Naturally, it creates a knowledge barrier. Women and men may not interpret the name of the area correctly, hence, they will misinterpret medical advices given for this area. Yet, a vulva is a very happening area. It is a place for various health discomforts. When you go to awareness programs to connect with women, we see that women get very surprised. Many would hear the name of the vulva for the first time and they want to hear about it more. Now that you could understand all this, you will interpret the health information that you get from various sources in society much better. From the doctor, from magazines, or from newspaper. Your interpretation will be much more simple. If you know them well, you will not confuse between cervix and ovaries, and you will not confuse between uterus and vagina. You will feel more confident in understanding health. So, what are you waiting for? Share this amongst your friends and families. Not everyone will be interested to know these pearls of wisdom, but at least you will know that you have tried. Be positive. Change your life.